So, Reena, how was your week?
Yeah, it's been a very busy week. Back to normal. This week was my first week technically back to proper work. I went on a very quick holiday the week before, so back into the swing of things, which is quite nice. I like routine, so I'm actually like looking forward to starting the year. And yeah, seeing how it goes. Lots of exciting things on the way.
Nice. Ali, how was your week?
I had a really good week. It was a really busy clinical week. For some reason, when we opened the practice like 4 years ago, the first couple of years, January was quiet, and I always thought that's a good time to take time off. And last year and this year, it's just been manic, which is great. And we just launched, or we've launched to our alumni, but we haven't launched it to the general public yet. But I guess by the time this comes out, we might have. A full arch course where we are doing a full arch course on cadavers. And I'm really excited because it kind of came together. I was just chatting to a few people. And what we're going to do is we're going to have a half day of theory. Then we're going to 3D print the jaws of the cadavers that we're going to be using so people can do hands on those cadavers. And then the next day we go in, we do the full arch work on the cadavers, and then we're gonna have photogrammetry and 3D printers in there and actually load the cadavers with a set of teeth that we design and make on site. So really excited for that because I just think it's what we've been doing here, and we figured out how to make it really easy to translate into that environment. So yeah, I've had a really fun week. Yeah.
Yeah.
How was yours?
I've had a good week. I've done lots of running, as always. Did a fell race yesterday, so I was running over the mountains, and yeah, came third, which was nice.
Congratulations.
The only issue with fell races is the prize is always a bottle of wine, and it's a bit like, well, I don't drink. Thank you for this wine that inevitably I'm going to bring to someone's house and go, thank you for having me. And they're going to probably bring it to lots of other people's houses. And I don't reckon that wine will ever be drunk.
Do you just have dinner with a bunch of people who don't drink? Is that why?
Kind of, but also it's like, it's not the nicest bottle of wine. And I just think it's always going to be one that you're just like, oh yeah, thank you for having me.
Maybe if you come first, they'll give you a really good bottle.
Oh no, they're all the same. Sadly. So the voice you heard at the beginning, this week we are joined by Dr. Reena Wadia, who is the founder and principal gum specialist at RW Perio, a state-of-the-art four-surgery clinic on Harley Street. She has been practicing periodontics for the best part of a decade, with many years of teaching on the topic to ensure highly effective results, which have been featured in the Financial Times, Vogue, The Times, and the BBC. Qualifying from the Barts and the London with the prestigious gold medal following general practice, Reena worked as a senior house officer in both restorative dentistry and oral surgery. She's completed the part-time specialty training program in periodontology at Guy's Hospital, and she previously was an associate specialist at King's College Hospital. And now she has a book coming out all on perio.
Busy, Reena. Jeez.
Very busy. Keeps me out of trouble.
So why perio?
Why perio? So, well, as an undergraduate, it was interesting. I was actually giving a talk to some students this week, and I was telling them, as an undergraduate, I literally hated perio. I thought it didn't work. It was boring. But which is a shame because sometimes it's still portrayed as that as an undergraduate. But actually, when I graduated and then started exploring the different fields, because I knew I wanted to specialize, but I just didn't know what's in. I thought I would go into prosthodontics. But then I thought I'd explore the restorative sort of specialties, see what it's all about. And I thought I'll just check out perio. And I observed some periodontists who were in practice, doing the real juicy stuff. I saw what it was all about in terms of the relationship with the patient, the results you can actually get, and then all the juicy surgery stuff that we weren't shown anything about, like crown lengthening, management of recession surgery. And I was just like, wow, this is amazing. Like, this is a specialty I want to explore further. And then during my SHO job, I did some oral surgery, I did some restorative, and I thought this is definitely it. And yeah, I haven't looked back. I'm still obsessed with it and I still love it. So, but I just wish that, and I think it's probably still the case. I think as at an undergraduate level, you're not exposed to what it really is about. So, yeah, it's worth looking into.
So was this the inspiration behind setting up your courses?
Well, the courses actually it came about. I've always loved teaching, and not many people do perio. So there is a kind of gap in the market there for actually educating dental professionals, hygienists, etc. But the courses came about because we were getting so many referrals from dentists, and I was thinking some of this can be treated in general practice, but you just need a little bit of extra learning or refresher. And I thought, what can we do? And the best way is just to educate it was initially our referrers, and then all other students who are linked with us, and that's how the kind of courses came about. And it really boomed during COVID because we had a whole lineup of courses in the diary, and then it was like shut down, lockdown, and I was like, what am I going to do? I really want to carry on teaching. So that's when I converted a lot of my courses to online, and then that was like crazy amount of people went. It was so nice actually to see people actually want to learn about perio. Across the globe, which is one of the beauty of having digital. So that's when everything properly started up with Perio School.
I have to say, I've heard really good things about your course. So,
Thank you.
I've heard feedback from like delegates, from the hands-on parts of it, from the theory parts of it, from your approachability. So,
Thank
I mean,
you.
you probably get this feedback anyway, but it's probably a good time to say this because it's only fair that you're someone who seems to have really invested in the people that come on your courses. It seems like, and like really spend the time with them. And I think it's like we're a very perio practice,
Mm.
and I said I'd never do two things, perio and implants, and it's basically like the
It's your
basis of the
life
practice.
now.
Yeah, yeah.
Cornerstone of everything. If you want to do things well,
Yes.
you've hit the nail on the head. Like you've got to get perio sorted first. And if you do, it helps in all the specialties that you do.
I just don't see a single any type of practice, whether it's general practice or specialist practice, that can be successful without getting that bit down.
Yeah.
And
Mm.
it's almost like I hope this isn't unfair to say, but I think like 99% of perio is almost algorithmic. If you are
Yeah.
protocoled with it and you do things properly and you don't skip steps, everything's fine. And it really
Yeah.
helps so many people that it doesn't make sense not to have a good grounding in it.
Mm.
Exactly. And I think you're right. It is all about quality of treatment. And doing it properly is key. Because sometimes it's like, oh, do a quick scale and polish, and you expect like 8 millimeter pockets to go down to 4. But spend a little bit longer, have better quality equipment, and understand how to use your instruments. You will find, I mean, the results are incredible at the moment, and there's so many new techniques out there as well. But just spending a little bit of extra time and also educating your patients, because it really is a team approach. If your patient is not compliant and engaged, you're not going to get the results. But you'll be surprised, even just a little bit of education and motivating them the right way, they will start. I mean, I've had patients who hate interdentals and they're like obsessed with them now. So
Yeah.
it's just about
Yeah.
getting people into the right habits. It's a bit like when you're working out and you're exercising. Once you're into it and you see the results, you're like, okay, I really like this now. So it's the same thing.
Mm.
I was kind of chatting with uh another practice owner, and we are talking about like how he has a really busy like general practice,
Mm.
and we were talking about how do you like if you buy a practice or you're setting up a practice, how do you make it so that the perio is sorted well? And kind of the conclusion we came to is there actually need to be four people that go on the perio course together, and it needs to be the DCP hygienist therapist who's going to be taking on most of the referrals, the generalists who are referring or who might want to do some of it,
Yeah.
the nurse who's supporting it all so that it isn't taken for granted, probably the head nurse who's doing the rotas, and
Yes.
then the practice owner so that the business is built properly around giving the proper resources, time,
Mhm.
and charging the right amount for this, and
Yes.
then it just works.
Yep,
Mm.
yep, completely agree. We actually now do, it's just funny you say that because we now literally do courses for all of those people, including nurses. We do a Peru program for nurses, Peru day for nurses. We do a business side of things, and we do like a 1 day course for dentists and hygienists. So I think, and it does really work well, as you said, in the practices where then every single person is singing from the same hymn book. And yeah, it just benefits everyone.
Yeah.
Mm. I definitely think it's just it very easily gets forgotten or sort of
Yeah,
pushed aside in so many practices, and at dental school it's
yes,
sort of very much treated as that, oh, this
it
is
is.
really easy for you to do in second year, like go do go do
It's
go
Yes,
the
do
first
this,
thing, and
yeah,
then you
yeah,
can move
do
on.
this scale,
Yeah.
and then yeah,
yeah,
you've done
true.
that, great, now you can actually try and do a filling, and
But then
it's
in every sense, it's the thing that brings the most problems in dentistry for the patients, for the practices, for the
mhm,
clinicians.
Yeah.
medical legally and beyond, right?
Well,
So
medical legally, it's the top of the list in terms of litigation. Three-quarters of claims are like perio-related, and part of the BDA indemnity board as well. And the types of claims coming in. The thing is, it's frustrating because some of them are really easy to prevent. Two reasons why people get litigated against it's failure to diagnose and failure to refer at the right time. So with failure to diagnose, what we find is it's not just saying to your patient you have gum disease, it's saying how severe it is. So, that's a key component. They need to know, Mr. Smith, you've got severe gum disease. What's the consequences of that? That you might lose your teeth. Because as obvious as it is to us, the number of patients I've had in the chair saying, "Oh, Dr. Reena, I didn't know I could lose my teeth from this. I thought I just had a gum infection and I could take some antibiotics." I'm like, no, you're losing your bone. You're going to lose your teeth. So I think some things that are obvious to us aren't so obvious to patients. And then the other thing is failure to refer at the right time. So being aware of those guidelines, even if the patient says no, you need to make sure it's in your notes and you offer it every single time. So I think, yeah, it's one of the most important things from a medical legal aspect. Also, the fact that it's periodontitis linked with general health, that's a really hot topic right now. And it's amazing what we can do in terms of positively by treating the perio, how we can have a positive impact on the general health as well. So there's so many different, and also just from a socioeconomic point of view, I don't know if you've seen the paper in The Economist a year or so ago, but they were saying how much money we can save. I think I can't remember the exact amount, it was billions basically by sorting the perio out. So it just makes sense, like 360, to be
yeah,
able to treat and sort of prevent perio as well.
Yeah. I think it is definitely empowering patients because I don't
Yes.
think lots of them realize how much it is down to them. And I mean,
Yeah.
I'm like, it doesn't, as I say to them, I'm like, it doesn't matter how good a clean I do on you. If you don't go away and change the things like this, it's not going to work.
I find though that it's because the biggest false economy that we have on the resources that we put into it is time, right?
Mm.
And so
Yes.
what happens is everything's a little bit rushed, and the time to speak to people and explain all of this isn't there. The time to do proper OHI, disclose every single patient, even if they don't have perio. And what happens then is the patients start to perceive the value of their appointments as having their teeth cleaned rather
Yeah.
than being educated, right? And if the
Mm.
person referring, say, to the hygienist
Yeah.
makes it clear that you are being referred to be educated, not to have your teeth
Yeah.
cleaned. So
Yeah.
it's just a whole
Oh, yeah.
structure that,
Yeah.
I have to say, like one of the things, when Flo joined the practice as a mentee, basically, she was spending half her week seeing patients and
Mhm.
half her week with Aston or I one-on-one. And it was really good. But one of the conditions was that she's taking over the way we made it work in the business is she took over the hygienist role plus some. And it meant that the resources meant that we could pay Flo full time to see patients half the time. And it was really important because having worked in the dental hospital in Bristol, in Perio, and having been in practice, set up the practice, had a couple of hygienists that just said it's this simple. This is all you have to do. And
Mm.
Flo's the first person that actually, it's like the nurses were like, she's disclosing every single patient. And I went, great. This is not something to complain about. This is awesome. But it's like the smallest
The
little
bill for
things.
disclosing tablets through the roof.
Yeah, yeah. They're just
Delicious,
complaining
yeah.
about it. But it's funny because it's not. I'm only saying this because it's never what people think. It's like those conversations are the most powerful thing. And it's that people feel like they don't have the time and the patients don't want that. And I
Yeah.
guess that's what you're fighting in how you're educating people.
100%. I would say to every single patient, it's like 80% about what you do and 20% about what I do. So, and the thing is, you have to, from the outset, the start of your appointment, start of your treatment plan, outline their responsibility and their responsibility in taking care of their health and the fact that there's no point us doing anything in perio unless they're engaged or at least trying. It doesn't, they have to have the perfect class score. They just have to be trying to improve their home care. And you can get some pretty amazing results if you do. But I think the key thing in perio, and I guess it just generally in dentistry, it's about communication. So it's about translating things that that they actually care about and that they're going to be motivated about. So saying something like, Mrs. Smith, let's get your pockets down from 9 to 4. They really don't care. They don't care about that, but they might care about saying something like, look, we've got to do this gum treatment. I want to make sure that you don't get dentures in the future. I want to make sure you don't, lose your teeth or wake up with blood on your pillow, or have a bad, have bad taste or bad breath that your wife's complaining about, whatever. So you've got to really, when you put it in that context, I find suddenly they get it. And when they get it, they will be motivated. And then you start treatment and they start seeing results. They think, oh, okay, my mouth feels different. And, people come back, and definitely our clinic where they've got more severe perio. I don't know if you've had this, but they come back and they're just like, I feel better. Like, I just feel like I've got more energy, and it makes sense because if you think about it, periodontitis is compared to like having a big ulcer, the size of your palm, just open, like a wound open in your body. It's going to make you feel a bit unwell. But when that's treated, you just feel better. So you can, see the results, and it's quite motivating. But yeah, patient empowerment is the key thing, and I think it's all about communication and building those habits and supporting them on that journey.
What's the biggest barrier you find when you're educating dental professionals? Are there different barriers? What's kind of, because with them you have to, I'm guessing through your courses it's the psychological
Yeah.
aspect you have to change.
Well, for dental professionals, the key thing you said earlier is time, and trying to get all of that done in like a half an hour appointment or 20-minute appointment is tricky, but it's not impossible. And I think if you have a really good structure to your appointments and you're super efficient, it's about being organized and being careful with what you can then say in that time. And for example, like, when you're giving oral hygiene instructions, I would just get rid of the models. They don't work. Go straight into the mouth, use a test drive, show them the interdentals, show them how it would feel. So, simple things that you have to pick and choose to make sure it works. I'd say time is the biggest barrier, but also a lot of dental professionals, they just want to do the glamorous, sexy stuff like composites, veneers, all of that kind of stuff. They're not interested in perio, which I get it. But the thing is, your work is just not going to look as good. It's not going to last if you don't get the perio sorted. So you almost have to see the perio treatment as like a preparatory phase to ortho or restorative or anything else. But it's like the foundations of anything. So, but it's really not uncommon to like forget about the perio, unfortunately, and that's why medical legally it's at the top of the list.
I mean, also just to throw this in there, the people who want to do all that exciting stuff, they haven't really realized that the economics of it mean that perio is the most profitable potentially and least risk thing you can do in dentistry.
Right.
And you're changing people's lives the most out of anything that you
Yes.
can really do. So it's kind of a no-brainer getting good at it to see if you enjoy it, and then you can always refer or be part of a bigger team, right?
Exactly, completely agree. Yeah, I mean, a lot of, I think people forget the value of hygienists in their practice, and they're such a great asset. They're such a great practice builder as well. So I would always say, if you've got hygienists in the practice, think about how you can work together as a team and really build the list and build the private potential in the practice because it's huge. It really is.
How did you find like setting up that practice on Harley Street?
Yeah, it was yeah, it was quite a yeah, it wasn't easy. So but I started off step by step. So when I was finishing up my specialist training, I knew I wanted to do things my own way. I'm quite picky with like protocols and equipment, and I just thought the only way, it wasn't that I actually wanted my own business in the beginning. I mean, I love it now, but the only way I could do what I wanted to do is by just doing it myself. So I actually, just as I was finishing, I wasn't even qualified specialist. I thought, how can I do this? I want to be in central London just because I had a kind of network of friends, mainly friends and colleagues that were across the UK, and I thought they probably would refer to me. So I thought central London is the ideal location. And I just hired out a room like once a week, and just it was very low risk.
Sabrina, why Harley Street?
I've always, since I was like a kid, thought, wow, Harley Street, you have it in your head that it's that medical district. But more seriously, I think there is a kudos that comes with Harley Street, and a lot of actually direct patients will
Yeah.
Google, especially in London, like Harley Street gum specialist. And so it does actually help build the and I really like the area because there's so many different specialties around, and it's almost like we've got this little community. So if I need to refer to a GP, I know someone down the road. If I need to refer to a nutritionist, there's someone there. If I need to get some scans done, there's someone upstairs. So and then not even just dental, then you have like dermatology in our building. We've got like dermatology, lots of other different things that you can cross refer. So it's quite fine. But yeah, initially I just hired out a room once a week and just to test it. And then slowly over the years, I kind of built up to a full week. And then it was during COVID actually that we decided, we obviously didn't know the pandemic was going to happen, but we had just before that signed a lease for the building we're in now, which we had to fully gut and refurb. And then COVID hit, which was just the drama. So it was really challenging, actually. We had to then do the whole fit out, etc., during the pandemic, and then kick off the practice in the new location. So it's not been easy actually, but I find that those challenges really shape then who you are, and they really help you grow as a person. And I think the key thing we found that's made it a success is the team around us. And I really do think it's all about your team. It's all about the values you have as a team and how you kind of drive that forward. It really is more than just one person's work, I think.
So I'm going to put you on the spot now. Now, if
Sure.
people are thinking they're in the same position, right? They're working in a practice or doing their training and they're thinking, actually, that really resonates with me. Like I work at all these practices and everywhere I go, something's
Yeah.
annoying me. So that's the
Yeah.
same reason I have a practice as you. So
Right.
my question is then, is there, one, two, or three things that have surprised you, that are things you didn't realize along the way, or that have been kind of in a positive way, like pleasant surprises through this journey,
Mhm.
nice byproducts that you weren't expecting?
I think doing the business side of things, it really helps in terms of growing your knowledge in a different, like it's almost like another specialty. And I think we're not taught like anything about that at dental school. And I feel like it really opens up your mind and really gets you thinking. It's almost like you're learning again. And I mean, I love learning. I think learning just keeps you interested. Otherwise, things get boring. So I think by doing something like this, you will find that you're going to go into this learning curve, and you will speak to people about it, you'll do courses, you'll read, or you just learn on the job essentially, but you realize how much in a funny way how much little we know about business and also the runnings of a practice. Like when I first set up, when we moved high street as well, my husband then got involved. I kind of roped him in because he was really good at all the other stuff. And funnily enough, he said to me, like, how can you not know how a dental chair works? I was clueless. I said, we're not taught any of this. He goes, how can you not know if you open this up, this is how the suction works? I said, I don't know. But it's things like
What's his background?
he's actually not even in dental, so he was in live events, and during the pandemic, so he used to do far more interesting things like tour with the Coldplay and Beyonce and everyone else. But the industry obviously went quiet during COVID, and so that's when I needed help with the build work, and he's really good at that. He's a project manager, and he's now our COO. But anyway, so I roped him in, and he was like, "How can you not know any of this?" I said, "Genuinely, we're not taught business. We're not taught how to problem solve with dental equipment." So I learned all of that because it's like you have to learn this. So one of the positives, I think, by doing something like a journey that you might not think you want to go on is you learn so much and it's really interesting. The other thing is like I think you learn to develop relationships with people and really improve your communication as well, because when you start a business, you're interacting with so many new types of people. It's not just you and your patient and your principal. It's now, you're dealing with lawyers, you're dealing with solicitors, you're then dealing with contractors and dental companies and everything else, and then also building a team. So I found that really like a learning curve, but also quite interesting to understand humans and like how people work and what motivates them. And yeah, that's just like another whole world. So I think for me, out of everything, I think it's the things you learn along the way, and that's what keeps life interesting as well.
Is there anything that you wish you would have known then, or that you would tell yourself that would make it easier, or has everything gone exactly as you had hoped?
No, I think like things like don't stress out and worry so much is one of the key things I would say to myself. I still say it to myself and I don't listen to it, but it's like it's easy when you look back and think, why was I stressing out about that small thing? At the time, it felt massive. So I think often we overstress about things that we don't really need to. You should still care about it, but often, I think we put a lot of pressure on ourselves. It might be because of the way we're trained as dentists, and the whole undergraduate program is quite kind of rigorous and competitive. And I think sometimes we put a lot of pressure on ourselves. And I think it's good to just like step off the pedal a little bit and be kind to yourself, I think is the key thing.
I think it took me 1 to 2 years. That was my not feeling like I'm constantly juggling everything and it's about
Yeah.
to fall apart. Just that feeling.
Yes. Yes. And then obviously at this stage, when you're doing your practice, etc., you're not like a student anymore with no responsibility. You might be married, you might have a family, you might have other commitments, etc. So it's you're then really juggling life and your business as well, which is quite hard.
Yeah. Like I'd say the funny part of it is that it tends to it's anything new. Like when you first qualify and you're in a room on
Yeah.
your own and there's no one
Yeah.
there is
Yeah.
new. But then it's another new feeling. But then your name's on the door, and clinically suddenly the heat is on, right? But
Yes.
I think we're talking through the podcast we're talking to all the people who have been really positive and made the most of things and had a really good journey. But it seems like that's a really common thread. A few of the
Yeah.
things you've said is having a team and working with the team, and then
Yes.
learning to just be okay with some things.
Yes, I think like trying to aim for perfection is not always a good thing. I think you've got to be happy, move on, and then just keep moving forward, I think is the key thing in the right direction.
So, what is your direction with the practice? What is your plan?
Yeah, so it's grown quite significantly thanks to our referrers and our amazing team over the last few years. We now have 6 periodontists working at the clinic, which is great because I mean I love having a team in terms of like even just the periodontist. It's so fun because we're all friends. We bounce ideas from each other. We help each other. We do presentations together. We organize educational events together, and many of them helping me with teaching events. So it's super fun. We also have 4 or 5 actually now advanced hygienists as well who've all done our diploma program. So we've got PG Dip in Perio. So
That's
the
cool.
growth, the growth, I think in terms of growing further, I don't want to be like a massive practice. I want to still keep that quality because I think after a certain point, I don't want to become, so we're going to continue growing, continue. We see referrals from all across the UK. So looking after our referrers, growing that side of things, but also then growing the educational side as well. So at the moment, we're doing a lot of sort of 1 to 2 day courses for dentists and hygienists. We've also got our diploma program, which has been super popular, which is like a 1 year program. We've got one for dentists, one for hygienists, and they get a PG dip and perio. And it's just been amazing to see over the last few years the cohorts going through that and the number of people like the dentists who don't want to specialize, but they want an extra qualification and just how, I mean, they don't need to specialize. They're just so inundated with perio, just watching their journey and how it's made a difference to their practice clinically, financially, everything. I just find that so rewarding. And this year we're going global. So we've now taken the diploma program for the hygienists, at least across the globe. So we have 4 groups this year. We're going to Australia, Sydney in April for one of the cohorts, and we've got another group coming into London. So it's going to be
So,
busy.
how does that work? They've signed up in Australia, and then you'll go
Yeah,
and
we
deliver all of the teaching in one go.
so we right. So with the Australia group, so we've got one big cohort who are Australia, like New Zealand. I'm doing all the teaching online, and then I'm going out for 4 days, and we're doing all the hands-on in Sydney.
Amazing.
And we're doing all the hands-on in one go, and yeah, we're just going to be keeping in touch with live Zoom sessions, things like that. So first time we're doing it this year, so we'll see how it goes. But I'm
That's really
super
cool.
excited, and it's great for me as well because I get to see like okay, across the pond, how do they treat perio? And it's quite different, and their mindset and everything. So you really learn a lot from each other as well. So yeah, we've literally got our first live Zoom tomorrow. So let's see how it goes.
That's
Oh, well,
incredible.
yeah, good luck. That is
Thank
amazing.
you.
And I mean, particularly as there's so many, it's definitely Australia is the place you get so many also British
Definitely.
dentists going to
Yeah.
as well.
Yeah.
Yeah.
So
But with perio, they are a little bit behind. So I think they want to learn. There's just not much out there. So yeah, it should be great for them.
That's awesome. Rena, how do you get your balance? You're running a practice and you're getting a lot of people coming off the streets. Um, how do you run the balance between you, right?
Sorry,
Because
I don't know why
no,
that
because
made me laugh there. It just made me, someone like really just rocking up.
no, because they are
With
because
bleeding gums.
Devils off the street, like,
no.
help me.
I mean, because if you're running a perio practice in a lot of parts of the country, 99% of your work would be coming from referrers. But on Harley Street, it's not that percent, right? And
Right,
so there's a balance to be had because people are coming in and they want comprehensive care. But if you provide too much within your practice, then your referrers might get worried about sending things
correct.
in. So how do you maintain that balance and
Yeah.
what kind of strategies do you have in place to protect your referrers?
Yeah, so right from the beginning, when I set up and I spoke to my friends that were going to be referring, I realized the key thing was to look after referrers and not steal work from them. So I've been so strict on this to the point where it's literally just a perio practice. We don't even place implants because I thought, you know what, then I'm kind,
Amazing.
certain
Yeah,
practices might be placing implants. So I said to everyone, like, it's literally purely perio. We do nothing else. So if obviously a patient's been referred, we would just get the gums under control. We even ask them if they want us to do like a little bit of maintenance with our hygienist, because traditionally you do a little bit, like a year's worth, and then send them back. But we even give them the choice, do you want us to send them back straight away? So we are very, very protective over them. And I think that's so important because the last thing you want is you essentially send a patient out and trust that referrer, trust the specialist, and that's an extension of your care as well and your reputation. So if
yes.
that then gets messed up in the journey, you're gonna run out of business. So we are really careful with that. Anyone who comes direct, we almost try to find out, do you have a dentist? And we outreach to them and say, look, this patient turned up, this is what we found. Or then if they don't have a dentist, then we actually just make the most of our referrer network and then send them patients too. So
That's awesome.
it works quite well.
Oh, that's a really nice way to sort of give back a little bit as
Yeah,
well. Yeah.
exactly.
Yeah.
So you wrote a book on
Yes,
perio.
yes. It is now live
Cool.
on Amazon, so you can get your copy, the Perio Handbook.
Amazing.
So what inspired writing the book?
So originally it was for our perio school students. So I teach them. I've been teaching for example, the diploma for 4 years now, I think. And there's so much content. And I remember like when I was a student, and still, if I'm learning about something, I like to have everything in one place. So I was like, I really need to do this book. So the last kind of 3 years, I started it about 3 years ago. Don't ever write a book. It's like the hardest thing ever. And someone told me that, and I didn't believe them, and then I started it. So but anyway, yeah. So I wanted everything in one place, and I wanted like a really nice key. It's basically a summary. It's a really easy read. It's not meant to be like a really heavy textbook. Just the things you really need to know for practice, all the new guidelines, because so much has changed, and something that you can just refer to like a manual in clinical practice. So I started it 3 years ago, and I just like finished it just a couple of months ago. And no, I'm really proud of it. And I think we've had so many people, it's actually become an international Amazon bestseller, which is crazy
Cool.
for a perio book. I think I'm very proud of the
Congratulations.
specialty. Thank you.
Yeah, I
So
mean, you started off with a handicap and it being perio.
yeah, exactly, exactly. So, but I think people know now, like, even if you don't love the topic, you need to know it. So, and a lot of the perio textbooks out there, they're like the ones at university that you just don't have time to go through those. It's everyone in practice just wants to stay up to date and have something to refer to. So we've had really positive feedback so far. It's available on Amazon, and yeah, if you do get it, let me know what you think.
What's the structure of the book?
So it's basically the whole patient journey. So it goes through, right, it's very, very long. I'm a very simple person, so I like to break things down. So it starts off with the patient assessment, a little bit of anatomy, and then patient assessment. So starting from the beginning in terms of history, taking the right questions to ask, probing, then special investigations, bringing all the information together, like the diagnosis side, and then treatment planning and all the different phases of that. We also bring in things that are really relevant to general practice, like what we call peri-emergencies. Like if you have a patient coming in acute pain, there are so many perio things it could be. So we go through all of that. And then the kind of joint specialties like perio-endo, perio-ortho as well, which is a big thing right now, a bit on implants as well. And then the last sort of section is the more advanced surgical stuff if you want to dip into it, like crown lengthening, recession management, pocket reduction surgery, all those types of things. So it's literally like everything you need to know in perio.
That's brilliant. And would it, for someone who's considering reading the book and going on your course, what are the benefits of one and the other?
I think that, I mean, the main thing is you just need to be up to date. The guidelines have changed medical legally. Firstly, I know I keep going about medical legal, but it's such a big thing right now. You just don't need that stress. So just stay up to date. With the courses, I think you can, you know, you'll be surprised how, as you said earlier, how much benefit it can bring your practice, clinically, financially, professionally. Like you'll see the change in your patients. And it's often like simple things that will make a big difference. And it's just about knowing that. I do think like obviously you can do we've got loads of online courses, but I do also think that in person it's much better, especially some of our hands-on ones like we do crown lengthening for dentists. Like then it's such a great skill for you to have in practice. So you don't even need to refer out. So I think really often perio is not even people, it doesn't even cross people's mind to do further education on, but honestly you're missing a trick. So like find out more about it, whether it's with me or anyone else. Like it's definitely something that will help you for sure.
Brilliant.
This is, yeah, it's been a fantastic chat there. Just before you go, we've got a little quick fire round to
Sure.
so you can earn your dental pearl. Unfortunately, it's not a real pearl I can give you. But what is your favorite procedure to do?
My favorite procedure, I'd say, would be aesthetic crown lengthening.
Nice. What is your favorite scrub color to wear?
Black.
Oh, nice, nice. And with no context, which is your favorite tooth?
Probably central incisor.
Okay. I was actually thinking, I was like, there's less teeth with obviously the gums there.
Yeah.
But, and if you had to start again, what would you like to do?
God, that's a hard question. That's not a quick fire question. If
I know,
had to
I
start
really ease
again.
it in with the scrub color and then
I don't know. I'd probably do something similar, to be completely honest. Or I'd go into just like pure teaching. I've always wanted to be like a teacher. When I was like, 4 years old, I had my little blackboard and etc. But I love sharing knowledge. So something along that line with a little bit of business, which is kind of what I'm doing now. So yeah.
You're living the dream.
yeah.
Living the dream.
Yeah. No, awesome, Reena. I met you years ago when you were doing your specialist training, and I met you at a BSP conference. And
Yeah.
it's just from afar, social media, been seeing kind of the evolution of the practice and your courses, and I just think it's amazing. You've approached
Thank
it
you
with
so much.
humility. You can see that you do everything like there's kind of no other way to saying it, like with excellence. So from a group of clinicians who are trying to deliver good quality work, but also down to little things like branding and creating an environment. And you can see all the attention to detail. The feedback from your courses, you can just see that like when you do something, you do it properly. And it's really cool to see that through this, you've maintained your positivity, your humility. So yeah, thank you for coming
That's
on.
so
It's been
kind.
such a
Thank
pleasure
you
to
so,
catch
so
up.
much. No, I really appreciate you having me as a guest. And yeah, keep up the great work. I love all the conversations. So I'll be following closely.
Thank you, Reena.
Thank you.